For decades, America's major cities have been the epicenters of the HIV epidemic, places where opportunity and diversity meet, drawing people from all walks of life. These urban centers are vibrant, full of energy and promise, but they also bring together a unique mix of challenges that make them especially vulnerable to the spread of HIV. In these cities, risk and disparity are never far apart. High population density, housing instability, and economic inequality create environments where the virus can thrive. Many residents face barriers to healthcare, stigma, and a lack of resources, making prevention and treatment more difficult. Despite scientific breakthroughs and improved treatments, HIV remains a stubborn challenge in dense urban areas like New York, Atlanta, and Houston. The sheer scale and complexity of these cities mean that progress is often uneven, and some communities are left behind. These cities are complex ecosystems where social, economic, and demographic factors intersect, fueling the virus's persistence. Cultural diversity, migration, and shifting populations add further layers, making it harder to reach everyone who needs support. To end the epidemic, we must look beyond one-size-fits-all solutions and focus on who is most affected and why. Tailored interventions, community engagement, and targeted outreach are essential to address the specific needs of each neighborhood and group. The fight is now about prevention, testing, and ensuring everyone with HIV can access care and achieve an undetectable viral load so they can't transmit the virus. Expanding access to PrEP, breaking down stigma, and supporting mental health are all crucial steps in this effort. Our success depends on understanding and addressing the unique local dynamics that keep HIV entrenched in our cities. Only by working together across communities, healthcare systems, and public policy can we hope to finally turn the tide against HIV in America's urban centers. Nationally, we've made real progress in the fight against HIV. New diagnoses have dropped over the past decade, reflecting the impact of expanded testing, better education, and improved access to care. More people than ever are getting effective treatment, with life-saving medications now widely available and easier to access for many communities. In 2023, nearly 39,000 new cases were reported, a significant decline from the epidemic's peak decades ago, when fear and misinformation were widespread. But this number is still far from our national goal of reducing new infections to under 10,000 by 2025. Today, most people diagnosed with HIV are linked to care quickly, often within a month of diagnosis, thanks to improved healthcare systems and outreach efforts. About two-thirds of those in care achieve viral suppression, meaning the virus is undetectable and untransmittable, an incredible milestone for public health. Yet a third of people living with HIV remain vulnerable, facing barriers like poverty, lack of insurance, stigma, and limited access to consistent care. The South continues to bear a disproportionate burden, with over half of all new diagnoses occurring in this region, where healthcare resources are often stretched thin. Men, especially those aged 25 to 34, are most affected, highlighting the need for targeted prevention and support for young adults. These trends are even more pronounced in major southern cities, where social and economic challenges can make prevention and treatment more difficult. The tools to end the epidemic exist: routine testing, PrEP for prevention, and efforts to reduce stigma, but progress remains uneven and not everyone benefits equally. To truly reach our goals, we must focus resources where the need is greatest, our cities and the communities hit hardest, ensuring that everyone, regardless of where they live, has the opportunity to thrive and live free from HIV. HIV's impact is not equal. Race, ethnicity, and sexual orientation are the strongest predictors of risk. The virus does not discriminate, but the society we live in does, shaping who is most vulnerable. Social and economic factors such as access to healthcare, education, and stable housing play a major role in determining risk. Stigma and discrimination further isolate those most at risk, making it harder for them to seek help or prevention services. Black Americans, just 12% of the population, account for 38% of new diagnoses. Hispanic or Latino people, 18% of the population, make up 32% of new cases. These numbers are not just statistics. They represent real people, families, and communities who are disproportionately affected. The burden of HIV is not shared equally, and these disparities highlight the urgent need for targeted interventions. These disparities reflect systemic inequities, not individual choices. Factors like poverty, limited access to quality healthcare, and lack of culturally sensitive services create barriers that are difficult to overcome. Many people in these communities face daily challenges that make prevention and treatment less accessible. Gay, bisexual, and other men who have sex with men remain at the epidemic's center, especially young Black and Latino men. These young men often experience multiple layers of stigma related to both their race and their sexual orientation, which can lead to social isolation and increased vulnerability. In 2022, young Black, gay, and bisexual men made up nearly half of new diagnoses among their age group. This is a stark reminder that prevention efforts must be tailored to reach those most at risk, and that support systems must be built within the communities most affected. Urban centers concentrate these vulnerable populations, and overlapping barriers, poverty, housing instability, discrimination, magnify risk. In cities, the challenges are intensified by crowded living conditions, limited resources, and the constant pressure of daily survival. Ending the epidemic requires culturally competent, community-led programs that directly address these inequities. Only by listening to and empowering those most affected can we hope to close the gap, reduce new infections, and ensure everyone has a fair chance at a healthy future. New York City, once the global epicenter of AIDS, now stands as a model of progress, thanks to decades of advocacy, investment, and innovation. Widespread testing, rapid treatment, and PrEP access have driven new diagnoses and deaths to historic lows. But beneath the surface, racial and geographic disparities persist. Black and Hispanic New Yorkers, especially in the Bronx and Brooklyn, still face higher rates of new diagnoses due to poverty and limited healthcare access. Structural barriers like housing instability and lack of culturally competent care keep these gaps open. The challenge now ensure every community benefits equally from medical advances. True success means closing these stubborn gaps and achieving health equity for all. Atlanta's HIV crisis is urgent. Its rate of new diagnoses is more than double the national average. Black residents, just a third of Georgia's population, account for nearly two-thirds of new cases, with young, Black, gay, and bisexual men at highest risk. This is a failure of systems, not individuals. Georgia's refusal to expand Medicaid leaves many without access to testing, treatment, or PrEP. Poverty, transportation barriers, and deep stigma further block care. Addressing Atlanta's crisis demands Medicaid expansion, investment in trusted community organizations, and a relentless fight against stigma. Without tackling these root causes, the epidemic will persist in the South. Houston faces a complex HIV epidemic. Over 30,000 people live with HIV and new diagnoses are rising. The epidemic is concentrated among gay and bisexual men, but the fastest growth is among Hispanic and Latino communities, now accounting for nearly half of new cases. Language barriers, immigration fears, and cultural stigma make prevention and care harder to access. Texas's lack of Medicaid expansion and Houston's sprawling geography add more obstacles. To reverse rising infections, Houston must expand culturally tailored outreach, mobile testing, and Spanish language services. Community partnerships are key to reaching those most at risk. The city's diversity demands solutions as varied as its people. HIV thrives where structural barriers persist. Lack of affordable healthcare, poverty, and stigma are the real drivers. In states without Medicaid expansion, millions fall into a coverage gap, unable to access life-saving treatment or prevention. Poverty forces people to prioritize survival over health, making adherence to medication and clinic visits difficult. Stigma and discrimination, especially against LGBTQ+ people, drive people away from testing and care. The criminal justice system disrupts lives and care, especially for Black and Hispanic men, and outdated HIV laws fuel fear. These invisible walls must be dismantled to end the epidemic. Real progress means changing policies, not just behaviors. Social determinants, education, neighborhood, income, and support shape HIV risk as much as biology. A person's zip code can predict their health outcomes more than their genes. Poor education and health literacy limit understanding of prevention and care. Living in underserved neighborhoods means less access to clinics and more chronic stress. Mental health and substance use issues, often untreated, increase vulnerability to HIV. These are not personal failings, but consequences of underfunded systems. Addressing these root causes is central to ending the epidemic. We have the tools to end HIV, but they're not reaching everyone. The path forward is about delivering proven solutions to those most in need, with a relentless focus on health equity. Funding must target the hardest-hit communities and support trusted, community-led organizations. Policy change is essential. Expand Medicaid, reform criminal justice, and invest in housing and mental health. Ending HIV requires a whole-of-government approach and sustained political will. We must fight stigma, spread the U=U message, and ensure no one is left behind. The future is possible if we act with urgency, solidarity, and a commitment to justice.